PPE, see safety. I'm gonna gather my general impression of this patient. I see a mother holding her baby. Baby seems to be in respiratory distress. I'm gonna check the level of consciousness of the baby. Hello, mom. I'm just gonna check your baby. Hey, baby, you okay? What happened to your eye? Okay. From here, I am going to check the airway, making sure there's no secretions, any foreign bodies in the airway. I'm gonna check breathing. I'm gonna gather my stethoscope, listen to breath sounds, looking for chest rise and fall. From here, I am going to gather my pulse ox, going to turn it on, attach it to the baby's big toe.
Pulse oximeter shows a saturation of 82% on room air.
Okay, so the baby needs some oxygen. So I am going to grab my non-rebreather, attach it to high flow O2. All right, turning it on, setting it at 15 liters a minute. I'm going to ask the mother to hold this over the baby's face. We're going to do a blow-by technique for the baby. While she's doing that, I'm going to gather some vital signs. I'm going to check the brachial pulse. I'm going to listen to breath sounds again, looking at the baby's perfusion, color, skin condition, breathing, rate, rhythm, quality.
That patient begins to develop decreasing SpO2, decreasing pulse rate, seawall respirations, head bobbing, and drowsiness.
Okay, so I am going to gather this, and I'm going to take the baby from the mother. I'm going to take your baby, honey. All right, properly grabbing the baby, putting the baby down, put that down. All right, I'm going to place this baby in a sniffing position, putting the pads under the baby's neck, under the baby's back, excuse me. Head tilt, chin lift. From there, I am going to measure out an OPA, tip of the mouth, tip of the earlobe, measuring out, inserting it. All right.
Patient accepts airway action. Patient's respiratory rate is now 20 breaths a minute.
Okay, so I am going to assist in ventilations. I'm going to attach BVM to high flow O2, 15 liters, connecting my capnometry reading to the BVM. I'm plugging this up. This is plugged up. I'm going to provide an adequate seal. Head tilt chin lift, excuse me. Adequate seal. CE technique, ventilating one breath every 3 to 5 seconds. Breathing 12 to 20 breaths a minute, excuse me. So with the capnometry, I'm just going to be checking my capnometry. I'm going to be looking at the pulse ox reading, checking the patient's perfusion, the color, condition.
How would you know if you're ventilating the patient properly?
Based off of equal chest rise and fall, and based off of the rate, rhythm, and quality of my ventilations. I am going to continue to assess this patient and transport to the nearest pediatric facility immediately.